the need for more long-term care beds in Nova Scotia due to the aging population and the COVID-19 pandemic. Nova Scotia is facing a growing demand for long-term care services as its population ages, and the COVID-19 pandemic puts more pressure on the healthcare system. Long-term care facilities provide nursing and personal care for people who need ongoing support and cannot live at home or in assisted living. There are two types of long-term care facilities in Nova Scotia: nursing homes and residential care facilities. According to the Department of Health and Wellness, there were 7,857 long-term care beds in Nova Scotia as of March 31, 2020. However, there were also 1,500 people on the waitlist for a long-term care bed, with about 800 of them waiting in hospitals. This means that many people are not receiving the appropriate level of care they need and are occupying hospital beds that could be used for other patients. The COVID-19 pandemic has also exposed the vulnerabilities of the long-term care system in Nova Scotia. The virus has disproportionately affected older adults and those with underlying health conditions who are more likely to live in long-term care facilities. As of February 7, 2022, there have been 1,027 confirmed cases and 84 deaths among residents and staff of long-term care facilities in Nova Scotia. The pandemic has also highlighted the challenges of infection prevention and control, staffing shortages, and quality of care in these settings. To address these issues, the provincial government has announced several initiatives to increase the number of long-term care beds and improve the conditions of existing facilities. In February 2021, the government committed to add 236 new long-term care beds in the Central Health Zone and replace or renovate 7 long-term care homes across the province. In February 2022, the government announced another 500 new long-term care beds in the Halifax area, as well as continuing work on 27 projects that will add or improve more than 2,000 beds province-wide. The government said these investments will help reduce wait times, ease hospital overcrowding, and enhance the quality of life for residents and staff. The need for more long-term care beds in Nova Scotia is clear and urgent. The aging population and the COVID-19 pandemic have increased the demand for these services and exposed the gaps in the current system. By adding new beds and upgrading existing facilities, the government hopes to create a more responsive and resilient long-term care system that meets the needs of Nova Scotians now and in the future.